Thank you. I want to start by stating categorically that People Before Profit will not be supporting this legislation. We opposed the renewal of these measures in the past and we're opposing them again. These measures to be extended till March and possibly beyond. And the reason is we don't trust the government with these laws, nor do we any longer have hope that this government will do the right thing in a manner that will build and maintain social solidarity throughout this pandemic and secure public health. In 2020, our citizens responded to the health measures with really admirable social solidarity. They respected lockdowns, they respected social distancing, and they took care of each other. And now we have a very high rate of vaccination. You went through the figures earlier, Minister. Fully vaccinated over 91%. I think partially vaccinated around 95%. And that 5% that remains unvaccinated, a huge cohort of them are very marginalised communities that I think the government could do much more to reach out to tell them and try and educate them and convince them that it is the right thing to do. I disagree with people who are opposed to vaccinations. I disagree with them, but I don't scapegoat them. And I don't think that they are the biggest part of the problem, particularly since our society has such a high level of fully vaccinated people. And the pandemic is still spreading, and it is not the fault of the unvaccinated, but this legislation could scapegoat them. But just to be clear, the vast majority of people do support the vaccinations. We saw the queues last week when the boosters were announced that they were available in places like City West. The queues were absolutely enormous. People waited around for nearly 5 hours to get their booster and vaccination. So they are enthusiastically embracing the vaccination programme. So it can't be framed that the problem is the unvaccinated, but I want to talk a little bit about what I see is a much, much wider problem. To start with the global issue, there is a huge problem in the spread of the variants. Delta and lately Omicron have become really frightening, and I watched a newsreel about South Africa earlier today, and they are being overwhelmed in their hospitals, mostly among young people. But it isn't just the result of a biological evolutionary process in the pandemic and in the virus. It's also the result of private ownership of the pharmaceutical industry and its drive to increase its profits at all costs. South Africa and other countries and the World Health Organization have repeatedly asked to lift the patents on these vaccines to enable countries to control the virus in their own way and to enable them to produce vaccines across the developing world. And tragically, and I really want the government to hear this, tragically, this government has not just supported but enthusiastically supported the European Union in backing the global pharma industry in their refusal to remove the patents. And this is the most brutal case of putting profit before the health of the population of the world. So now we have a greater pool of unvaccinated people in the developing world, which gives the virus more and more scope to mutate. Last Christmas, I heard the remarks of Deputy Lahart earlier on about how our government has followed the science at every step and has taken the advice at every step. It's just not true. Last Christmas, there was clear advice given to the government that you choose to open up the economy or allow people to visit each other's homes during the Christmas period, but don't do both. And what did we do? The government did both. They ignored that advice, and that has led to a further lockdown and endangering thousands and thousands of lives. The failure to respond to the scientific evidence that COVID-19 is an airborne disease, and the failure to legislate and regulate for cleaner air in all workplaces, and most importantly, including schools, and the failure to respond to that science, I think, is outrageous. And that was a choice. Advice was given, it was scientific advice, an expert group was set up, they gave the advice and you chose to ignore it. There have been shambolic and dangerous policies in our school, and we have put at risk thousands of unvaccinated children, their teachers and their families, SNAs and other staff. And alongside the totally inadequate conditions, we stopped testing and tracing in schools, which was a deliberate policy to hide the number of cases. There's incoherent and inconsistent policies around antigen testing. This should have been available from the start, but the government have been dithering and procrastinating and worried about the cost of it. And these tests have become another excuse for rip-off Ireland. It's clearly shown in Britain, in France, in Finland. Those tests are free to people who are worried about being contaminated with COVID or who have shown symptoms. In Portugal, in Germany, they cost as low as €1 each. Here, they're as high as €8 each. Rip off Ireland all over again. And there's been mixed and confused messaging that has undermined public confidence in public health measures like, dare I say it, Golfgate and Mariongate. And despite that, people still responded in an overwhelming, responsible manner. But I think this government has failed us, and it's failed to introduce a comprehensive national sick pay scheme, failed to increase the hospital bed capacity, the ICU capacity, failed to pay the student nurses and other student cohorts who worked so hard for us during the pandemic. And we failed to give the nurses more leave, to increase their pay, and it's one of the main reasons why we continually hear nurses talking about emigrating from this country. We failed to take private hospital capacity into public ownership, despite vast sums of money being paid over to those private entities. And we failed with an ineffective and outsourced mandatory hotel quarantine system that has really served as a racist theatre where we single out countries from which people may or may not come freely into this country. Now we're being asked as elected representatives to extend this legislation that's going to impact on people's rights without the parliamentary scrutiny or the robust analysis that other deputies talked about. The majority of people in this country will continue to do the right thing if they have confidence in the government to maintain social solidarity. But that confidence is constantly being eroded, and particularly by dishonest messaging, and I call it dishonest messaging. The schools are safe messaging was totally dishonest, and overnight has been replaced with a contradictory, unapplicable instruction to principals to take masking instructions from the department. Now here I want to go into a little bit of detail, because this is a thing that's worrying principals and teachers right across the country. I'm going to read from a letter that a deputy principal sent to Norma Foley, and you'll probably see sight of it. I'm concerned that the ambiguity surrounding the memo given to us leaves us in a very vulnerable position as a school. This was issued not as a PDF and not on a departmental paper and is not at all signed. It's unclear under whose authority this has been issued. The memo states that we should refuse entry to school children, which is in stark contrast to all other circulars and statutory instruments regarding access to education. Usually there are protocols and procedures in place that involve discussions with parents and lengthy interventions before we would take such a drastic step as to exclude a child from school. Is this memo legally binding, and if so, can you clarify its status in terms of legal instruments? I'm finished the quote. I'm not directly asking the question myself, although it would be useful if it could be answered. And I know not everybody's going to be able to see this. I can, and the civil servants here and ministers here would be familiar with it. That's what a memo looks like, an official memo from the department. It's on headed paper, it has Oireachtas written all the way across it, and it's signed. This is what was sent out to the schools, instructing them where a medical cert is not provided by a pupil, they will be refused entry into the school. Not on headed paper, not signed, not in the format that one could accept that that's a legally binding document. And that has to be urgently clarified to the schools, to the parents and to the children. By the way, I believe that the recommendation for everybody who can to mask up is the right thing to do. People before profit see it as part of a suite of measures that will help prevent the spread of the virus. But I would like to ask Norma Foley and yourself if measures come in sweets to help prevent the spread of the virus, and I don't mean bags of sweets, I mean S-U-I-T-E-S. If they come as packages of things that we must do, then where are the HEPA filters for our schools? Science has told us that they help in the fight against the spread of an airborne virus. But we'll give the kids masks, but not the filters. We'll give them instructions to exclude kids, but we won't give them the testing and tracing that they need in the schools. And this heavy-handed approach, combined with the failure to heed the science, has only served to increase anxiety and hesitancy. The powers given to the Gardaí in this legislation are also very disproportionate and worrying, or disproportionately applied, I should say. We got in May figures from fines from fixed payment notices issued by the Gardaí, and at that time, of the 6,066 fines issued, almost half were issued in 2 Garda stations, Blanchardstown and Ballymun. And this is obviously clearly where the Gardaí were working the hardest. In working class areas, with 70% of those who were fined under the age of 35 years of age. The disproportionate application of those powers is extremely worrying, and that is why we don't believe they should be extended, but we should depend on the social solidarity and goodwill of people responding to a government that seems to know what it's doing, but not to a government that doesn't seem to know what it's up to. On the same vein, how many managers of meat plants have been issued with fines for their failure to protect the workers in those meat plants? Only last week, we heard of an outbreak in a meat plant with 260 cases. And the week before that, we heard of a grant being given to the meat plant industry of €78 million, allegedly to help them through Brexit. But we couldn't spend €12 million on providing every classroom with a HEPA filter. This week, you and your government voted against giving those meat plant workers the right to a sick pay scheme that would help to keep them safe and would mean that they didn't feel obliged to go into work and spread the virus when they had symptoms or when they were sick. Where are the fines that have been issued to directors and managers of nursing homes? The outbreaks in nursing homes are rising again and again. Where are the increased capacity in the Health and Safety Authority to inspect workplaces? We're told 1 extra inspector this year. So your policy is so weak in the strategy that it takes to actually quell the virus with practical measures, but instead relies entirely on personal behaviour. There's a very good article in the Irish Times today. When I grow up, I want to be able to write like Orla Muldoon. She's a professor for social industries in research in Limerick. And the way she puts it is, she said, eulogising personal responsibility is usually a counter-narrative designed to obscure systemic failures. The failures in our system are serious. An overburdened health service going back many years, a PCR testing system that cannot meet demand, a track and trace system that's not been able to keep up with the reported levels of infection, historically overcrowded classrooms and mitigations in those classrooms a long time coming. And to continue with personal responsibility as a solution to the greatest crisis of our time is a political choice, a shameful abdication of political responsibility and leadership. I couldn't agree with her more. COVID-19 has brought into sharp relief the utter failure of the capitalist economic model to protect our health, and the utter failure of this right-wing government. In the same breath as we seek to extend far-reaching powers, this government has cut the pandemic unemployment payment to the bone and is due to completely end it as this legislation is extended. There is absolutely no intention in the legislation to reintroduce the eviction ban as we face into the winter. There's no intention to ban rent increases. There's no measures to deal with the energy crisis and the rising price hikes that people are facing while they're expected to stay at home longer. The only response to the energy crisis is for Minister Ryan to announce this week that he's allowing the building of another 7 gas-fired power stations to fuel data centres at a huge cost to the Exchequer. Now, I don't want to be all negative. I want to finish on what we could do. First of all, I think we need to replace your government. We need to get rid of Fianna Fáil and Fine Gael and replace the government with a genuine left-wing government that will defy the rules of the capitalist system and take measures that are necessary to protect people's health. Increase hospital capacity to reach the EU average level of beds per 1,000 of the population. Increase the ICU capacity to 500 beds. We only have 5.6 beds per 100,000 of the population. The average in Europe is 12 ICU beds per 100,000. bring staffing levels up to the staffing levels of public health teams up to the recommended levels. They're currently a third of the recommendation. Take private capacity of hospitals into public ownership and ensure an integrated single-tier health system for COVID and non-COVID healthcare. Resource the test and trace infrastructure to ensure rapid access to testing, including walk-in test centres, free antigen tests and state-of-the-art contact tracing. Restore the contact tracing in schools in full and work with teachers and their unions to help resolve the staffing crisis in the schools. Establish legal minimum requirements for ventilation and air filtration in all workplaces and providing resources to ensure that this happens. Pay the nurses and the midwives and the student nurses and abolish the fees that they must pay to enter college to have these careers. Speed up the booster vaccine programme with priority for vulnerable, elderly, healthcare workers and those areas of our society where there's low vaccine coverage. And most importantly, demand that there is a waiver on the intellectual property rights of vaccine production. We need to restore the PUP for those losing their jobs and their earnings because of any new advice that may come out today. And ultimately, we absolutely have to move away from the disgraceful health service we have lived with for decades and increase our capacity to a system where we always have about 20% as overhead in cases of emergency. Now, they might seem like way over the top socialist policies, but that is what we need to do, and that is why I say that if anything else COVID has shown us is the utter failure of the capitalist mode of production and economic activity to protect the health of human beings on the planet.